Hey everyone, this is Dr. Eric Block showing you the final restorations of these back-to-back Class 2 composites. And as always, I want to make your practice more efficient, productive, and of course less stressful. And here we go, we're going to do back-to-back Class 2s. I'm going to place two bands, one wedge, one ring. And I really like these V3 bands because I can grab the tabs. It just helps me place them easier. And I place these two bands right next to each other. So I'll do typically an MO and a DO at the same time with two bands, one wedge, and one ring. And I used to do this one at a time. I would do one side, place and restore and cure, and then I would do the other side. And it was very time consuming. So now I'm doing them at the same time. I'll fill one side, and I'll show you how I do that, and then immediately fill the other side without taking the bands and the ring off. So here I'm just positioning the V3 ring. I want to make sure that I have a nice stable wedge, the bands are stable, the ring is stable, and everything is nice and secure. And this is really key here, is burnishing the band to get a good proximal contact and be able to get good visibility into your prep. And I personally love using microprime. I use it pretty much for all of my fillings, for crown inserts. I like to clean off the tooth, and it helps desensitize. So I'll use a micro brush and do a round of microprime and then air dry it. And then I use one step prime and bond elect. And you can use anything. Use what you want to use. Like I always say, you be you, me be me. But this is what I use. I like to use the one-step bond. I feel it does just as good of a job as the two or three-step bonds out there, and I'm getting predictable results, and patients aren't coming back with sensitivity that often. It happens, but they're not coming back that often. I also love using the Velo light, which is a high-intensity UV light. It's very quick and powerful, and I'm getting consistent results. Okay, so here's my flowable composite, which I use as the first layer, and I cover all exposed dentin. And you can pick any flowable, anything that really runs well, and you can use the Explorer or probe. Most of the time I use the probe, and I'll just kind of push it where I want to push it and let it kind of soak in there and get into all those little nooks and crannies and seal off the band and get into any areas so we don't have any voids. Then I'll go back to the Velo light here, and then bulk fill time. And when I say bulk fill, I mean this is two steps. I use a flowable first, and then the bulk fill, which is by GC Universal. And this is a really thick flowable material, and kind of push it where you need to go. It's got a very special tip to it, which I really like, and it sets up nicely. Sometimes I'll use the Explorer here to kind of push it where I want it to go if there's any voids, but usually I give it about 5 to 10 seconds to kind of slump into place, and it's a great final fill, and it's very strong. It looks great on the X-ray, and again, they're coming back very predictable. So I'll cure it with the Velo light, and then I will start to work on the other side. And this is how you do back-to-back Class 2 composites. You do one side and then the other, and the key is burnishing. You have to really get a good burnished band, otherwise you're going to have an open proximal contact, and the patient's going to get food trapped, and they're going to come back, and you're going to have to redo it. So better do it now and do it right, and make sure that the band is up tight against that proximal box. The wedge is really in there and it's sealed well. Because if it's not, then you're just compounding errors, and patients are going to come back. There's going to be overhangs or open contacts, and they're just not going to be a happy patient. So I'm just rinse and repeat here. I'm using microprime, then the SE bond with my brush, and I just make sure I get in there really good and it's really soaked in really good, and then I air dry it, and then we'll cure it. And I do this predictably for all my fillings, and it's like I always say, it's a workflow, it's a cookbook, and I go from step to step to step, and I don't skip steps, and their patients are happy and they're wowed about how fast it is, and they're not coming back very often with complaints, which is always the goal. So again, this is Tokiyama Omnichroma, And I like this material because it just allows me to keep minimal amounts of inventory in stock with the Flowable. I use it a lot for anterior cases because it has that uh, chameleon effect where it takes on the shade of the tooth. So I really don't have to keep a big stock of shades anymore. And then I'll go to my bulk fill after I've filled the entire box with the Flowable and covered all dentin. Now I'm going to fill the rest of it with my bulk fill. And that's it. I just use these two materials. If it's really deep, then the bulk fill I'll do in two increments. But most of the time, I'd say 90% of the time, it's the first layer of Omnichroma and then the second layer of the bulk fill, and that's it. Now let's take everything off. I've finished my curing. Take the ring off. We'll take the bands off and take the wedge out. Now sometimes the bands are in there so good because you burnished that you have to use a hemostat. So I'll typically use the cotton pliers and wiggle it around and it comes loose, but if it's in there really good, then I'll have to use a hemostat to pull it off. But you can see how those bands, they're really in there well, which means I'm going to have a good proximal contact. And you can see the contours are pretty much all there for me. Final cure, and then it's off to finishing and polishing. Again, thank you so much for joining us, and the next video will be to restore the premolars.